Good evening, everybody. I did my PowerPoint presentation on schizophrenia. We will be talking about the introduction of schizophrenia, the symptoms of the disorder, the prevalence, the prognosis, the treatments, and I have a real life example at the end. Uh, my introduction is schizophrenia, by definition, is a mental disorder that is characterized by incoherent thoughts, bizarre or odd behavior, odd speech, hallucinations such as hearing voices. Typically, the age of onset for schizophrenia is in the late teen years to early to mid 30s. People with schizophrenia require lifelong treatment and medication to help manage the disorder. There is no cure. I feel like I have to stress that, but there is no cure at all for schizophrenia. Some of the signs that we would see in teens that have schizophrenia would be a withdrawal from friends and family members, major drop in their school performance, trouble sleeping, they're highly irritable, they have a very depressed mood, and lack of motivation. Now, of course, many people will say that this is just simply puberty or, they're going through a tough time, but get your teen checked out if you see any of these signs. I'd rather be safe than sorry later on. And teens that are diagnosed with schizophrenia are more likely to have visual hallucinations versus delusions. Most people are likely to start showing signs of schizophrenia in their teens. So around 15 or 16, they can start to show them as early as 5 years old, though. So please, if you see any of these signs, get them checked out. Now, there is a lot of signs for adults that do have schizophrenia, and they are as follow: trouble thinking logically, hallucinations, so hearing voices, lack of emotions when speaking, so showing no empathy, having odd or unusual beliefs, thinking, for example, that the CIA is after you when there is probably no chance that they really are, having difficulty paying attention for short or long periods of time, lack of pleasure while doing everyday activities, simply as watching TV or reading a book, agitations, repetitive movements, trouble with decision making, problems with a working memory, so your short term memory, and they are extremely disorganized with their motor behavior. Some of the statistics is there is no cure for schizophrenia at all. Around 20 million people in the world have schizophrenia. The US, along with India and China, are the top three countries that have the most diagnosed people with schizophrenia. Every 1 in 100 Americans are diagnosed with schizophrenia. There are four types: paranoid schizophrenia, catatonic schizophrenia, disorganized schizophrenia, and undifferentiated schizophrenia. Roughly 40% of people that are diagnosed with schizophrenia are left-handed. And I thought that was extremely interesting to find out. Along with the fact that African Americans are 3 to 4 times more likely to be diagnosed with schizophrenia. And normally there's a genetic variation that increases your risk by 80%. Men and women are equally likely to develop schizophrenia, though men do tend to develop it slightly earlier than women. Childhood versus adult schizophrenia. Childhood schizophrenia normally appears around age 5, and it's really hard to distinguish at this time because it could be mistaken for uh, possible autism or some other behavioral disorder. Adult schizophrenia normally starts to appear around the teenage years, and by this time it is slightly easier to distinguish schizophrenia from another disorder. Both childhood and adult schizophrenia do share some possible causes and risk factors, such as genetic factors and/or genetic mutations of the genes, possible infections in the womb during pregnancy, as well as serious infections during childhood that could cause a traumatic brain injury or a traumatic infection such as meningitis. And lastly, there could be just psychological trauma from their childhood that could have schizophrenia onset as early as 5 years old. The prognosis for schizophrenia is that it requires a lifelong treatment. It can be managed with medication, psychosocial interventions, hospitalizations, and therapy, but it all has to be done at all at the same time. And I can't stress that enough. It can't be one thing or the other, but it has to be medication management along with therapy and having a normal pattern, normal routine helps keep the individuals more routine. Um, some of the medications that are used is risperidone, Seroquel, and haloperidol, and individual therapy that helps to normalize the thought pattern, social skills training that helps with communication and daily activities, and family therapy that provides education and support to individuals with schizophrenia and the families goes a long way. And I can't stress that enough. My thought process on the challenges of treatment is that I feel like there's a lot of stigma and fear around being diagnosed with schizophrenia. But if you're really, really on top of it and you want to have the help, you will do it to get yourself better. A lot of patients, they have high fears of the medications that they would be put on. Some of the people get diagnosed late in life. And I mean, I've seen cases all the way up to like 50 and 60 years old that they haven't gotten diagnosed until then. And they've gone most of their adult life having major breakdowns. Um, and there's also just a lack of awareness that they may even not realize that they have schizophrenia. Um, and some patients, there's always resistance, along with they have fears about therapy, and along with their doctor. If they have a really good health team, though, I feel like they can they can work past their fears. My real life example was Zelda Fitzgerald. I'm sure many of you do know who she is, but if not, she was the wife of F. Scott Fitzgerald, one of America's greatest author and playwrights. They met in 1918 and they got married in 1920. Zelda did start showing signs of childhood schizophrenia in her around age 10. She suffered with a lot of mood swings and erratic behavior starting around that age, along with um, hallucinations. And they thought she could have been misdiagnosed with bipolar, but she was then diagnosed in 1930 with schizophrenia from Dr. Eugene Bleuler in France, and she was moved to a sanatorium. Later that year, she was then moved to a mental health clinic in Switzerland, and she would be released in 1931 in September. In 1932, up until her death in 1948, though, she was in and out of mental institutions. Her behavior became more erratic, and she had started to have more prominent delusions. And the end of her life was a sad time. And on March 10th, 1948, Zelda was awaiting electroshock therapy. She was locked in the room, and she unfortunately died in the fire that passed through there. She was only identifiable with her dental records and a slipper, guys. I hope you had a wonderful time listening to this, and I really enjoyed sharing this with you. Hope to see everybody's videos. Thank you.